Good afternoon, everyone, and welcome to the webinar today, Supporting Cultural Responsiveness in Youth Mental Health through the Framework for Mental Health in Multicultural Australia. My name is Ruth Das. I'm the Partnership and Engagement Lead for the Embrace Multicultural Mental Health Project. And today we'll be showcasing how the Embrace Framework for Mental Health in Multicultural Australia has been applied to improve the cultural responsiveness of headspace centres through a pilot project. Particularly being applied to young people's mental health. And we're pleased today to be joined by members of Headspace National Multicultural Practice Team and also Dandenong Headspace Team in Victoria. Just as some background information to today's webinar is being recorded, and the recording will be available on the Embrace website and also on the Embrace YouTube channel. The participant chat has been disabled for today, and you can turn on closed captions from the meeting toolbar. There will be time at the end of the webinar for questions, and you can submit any questions that you may have during the webinar through the Q&A function at the bottom of your screen. Please feel free to do that at any time during the webinar. We will be sending a feedback survey after the webinar, which you will receive at the end of the webinar. So keep your eye out for that. And we appreciate you taking 5 minutes to complete the survey. I'd like to begin today's webinar by acknowledging the traditional owners of the country. I'd like to acknowledge the First Nations people as the traditional owners of the country throughout Australia, wherever we're meeting today, and their continuing connection to land, sea, and community. We pay our respects to them and their cultures, and to all elders, both past and present, and to express our support to reconciliation, treaty, and truth-telling. I'm joining you today from the lands of the Ngunnawal and the Ngambri people, who are the ongoing custodians of this land. Also, I'd like to recognise people who have lived experience. We recognise the unique contribution of people with lived experience of suicide, mental ill health, and those who love and care for them in championing mental health reform. We celebrate people of all backgrounds, genders, sexualities, cultures, bodies, and abilities. So today's webinar, as I mentioned, we're going to provide an overview of the Embrace framework, how it can be applied to a youth mental health context, and practical examples of cultural responsiveness from a Headspace Centre. As I said, my name is Ruth Das. I'm the Engagement and Partnership Lead for the Embrace project. I'll be providing an introduction to the Embrace project, and then we have some fabulous speakers from Headspace, Christine Molina, who's the National Clinical Practice Manager for the Multicultural and Family Inclusion team at Headspace National. And then we have Deirdre Brown and Laura Boscalia, Manager and Clinical Lead from Headspace in Dandenong, Victoria. And as I said, we'll also have some time for question and answers at the end of the webinar. So please feel free to add those through the Q&A function at the bottom of your screen. So the Embrace Multicultural Mental Health Project is funded by the Commonwealth Department of Health to provide a national focus on the mental health and suicide prevention for migrant and refugee communities. It has two main aims. Firstly, to improve the cultural responsiveness and workforce of mental health and suicide prevention services. And then secondly, to increase the mental health awareness, literacy, and capacity in migrant and refugee communities. As we know, Australia is a multicultural country with over 51% of people either born overseas or having one parent who was. Migrant and refugee communities often face unique mental health stresses, such as pre-arrival trauma, for example, war, persecution, human rights violations, and secondly, a lot of settlement challenges, such as racism, language barriers, family separation, and acculturation to a new country and finding new housing, employment, and school opportunities. There's a growing body of very strong research that indicates that people from refugee and refugee-like backgrounds may be at higher risk of psychological distress. Despite these risks, there's often a low uptake of mental health services amongst migrant and refugee communities. So in order to address these needs and these issues, the Embrace project developed the framework for mental health in Multicultural Australia as a tool for supporting mental health services to provide culturally responsive services, mental health services to migrants and refugees. What is the framework? It's a free, nationally available online tool that's available on the Embrace website. As I said, it supports Australian mental health and suicide prevention services and workforces to work effectively in a multicultural context. It consists of a set of tailored modules and self-reflection tools, and it's mapped against national standards such as the National Mental Health Standards and the National Safety Quality Health Standards. It's self-paced, it's freely a freely accessible resource. The framework is it supports services to consider, plan, implement, and evaluate how their service supports multicultural communities over time. It turns practice principles into action. It helps services develop detailed strategies. It's a process for assessing capability and strengths. It helps services make measurable improvements and to document those. It also helps services and organisations track changes over time, and it's a really useful quality improvement tool. We had a conversation at the Embrace project with Headspace National about how we could support the work that they do in improving headspace centres to use the framework as a tool to improving cultural responsiveness and to complement the work that was already being implemented across centres. We decided to develop a pilot project where we would work specifically with 5 headspace centres to explore how headspace centres could better support multicultural youth by using the Embrace framework as a tool to refine service delivery. So we selected 5 centres across 4 states through an expression of interest process to support and work through the framework over a period of 6 to 8 months. Each of the 5 centres worked through the framework to identify their strengths and opportunities to enhance cultural responsiveness. And findings from this pilot project will help to inform a national approach for Headspace in using the framework across all centres across Australia. So over the 6 to 8 months that we worked closely with the 5 centres, we asked each centre to form a working group with executive support. And we asked each centre to communicate across the centre to all staff that they were embarking on the process of the Embrace framework, and they were looking particularly at cultural responsiveness and how services could be improved within their centre. Each centre working group went through the module assessments online and completed the assessments. And through that process, they created a specific action plan for their own individual centre with timelines. Each centre then set about implementing the action plan that they had created. And over the 8 months, all of those 5 centres came together for support meetings with the Embrace team, staff, and also attended reflective sessions with the other participating Headspace centres to reflect on what they'd learned and how the process was going. So across the 6 to 8 months, the Embrace team met around 20 times across the 5 Headspace centres, and 5 individual action plans were developed for each centre. We had one online introductory session with all of the 5 Headspace centres to go through and look at what the framework process entailed. And we held 2 online reflective sessions with the 5 centres combined to talk about how they were finding the process and to troubleshoot any issues that were happening. Along the way, each centre completed a midway report, and we consolidated the learnings to guide a process from going forward from there. And each centre has also completed a final report. And from the final report, we're developing a national model that we can recommend to Headspace to be rolled out across all Headspace centres as a really effective way of using the Embrace framework in Headspace centres. So I'd like to now hand over to Christine Molina, who is going to talk about the work that the Multicultural Practice Team does. Thanks, Christina.
Thanks so much, Ruth. And hi, everyone. Good afternoon. And thanks to the Embrace team for having us along this afternoon. I'm really excited to speak about the work that we are doing in partnerships with this great organisation. As Ruth mentioned, my name's Christina. I use she, her pronouns, and I oversee multicultural and family inclusion at Headspace National. I am coming from the lands of the Wurundjeri people here in beautiful sunny Naarm. It's great to have the sun back for those of us who are here, and want to pay my respects to the lands that we're all on coming from today as well. So we thought I'm going to speak to you a bit about Headspace, what we do, who we support, but also the work the Multicultural Practice Team has been and continues to do in this space, and the type of engagement we have and why we're doing this in the first place as well from a Headspace national perspective. So for those who aren't aware, Headspace is the National Youth Mental Health Foundation that supports young people and family between the ages of 12 to 25. Now, we have a range of services that include mental health, work and study, supports around drug and alcohol, and physical health, including sexual health. And we also offer free online services as well, with our eHeadspace for counselling services and work and study, and a whole lot of resources online via the Headspace website. Each centre, we now have 175 centres across the network, across the country, including some regional and remote centres as well. So we do have a big national reach, and as you can imagine, our services need to be able to be adaptable to all the different community needs and service needs for young people and their family as well. A little bit about the Multicultural Practice Team. So the Multicultural Practice Team, we often say a small but mighty team at Headspace National. There's some of you may have engaged with us in different ways, but our role really is to support culturally responsive practice across Headspace National head office, as well as the Headspace network and our online services. So that means our focus is really building on culturally responsive workplaces, developing resources, and strengthening the capacity of our workforce to build and strengthen relationship with multicultural communities. And of course, a great example of this is working alongside and in partnership with organizations like Embrace to help improve our structures and frameworks to do this better and much more created for the local community as well. The Headspace National head office, we actually have a multicultural practice strategy. So this very colourful strategy that you can see here was actually embedded into the ways of working back in 2024. And really what it speaks to is how we approach multicultural engagement from young people, family and community. And one of the great things about this strategy is that we've been able to use this strategy to be able to engage with partner organizations like Embrace, grassroots orgs, as well as schools, right through to individual young people and family and community to really look at and continue to develop the way that we do work with community and alongside young people as well. In terms of the work that we actually do, the Multicultural Practice Team, we do a lot. We like to work really closely with others in the space, within Headspace, but of course, as I mentioned already, with partnerships as well. As you can see, we've got lots of things. We like to be busy, but I think one of the things we really enjoy doing is making those connections with others, and ensuring that lived and living experiences of multicultural young people and their family is embedded in all the work that we do as well. One of the areas of work that we've been doing over the last couple of years, I don't know if people have heard of the Reverb program that we facilitate and co-deliver with the Centre of Multicultural Youth. And that's a really great example of that co-design with multicultural young people and delivering it at scale to the Headspace network. I think the last count we had was over 450 staff have been gone through the workshop to help support care and support for multicultural young people that are accessing services as well. We've got lots of resources. So for those of you who are interested in seeing the type of, I guess, resources we can and do deliver, we've been really fortunate in being able to work with community and young people and family to deliver these resources. As you can see there, we do have multilingual resources, YouTube clips, and Strength in Our Root campaign, which really focuses on the strength of multiculturalism and diversity as well. So I guess, when we were speaking to the Embrace team, we were really thinking about what culturally responsive care looks like for Headspace. And for us, we're really thinking about how this looks in practice, in structures, and also how we also value the contributions and experiences of our First Nations young people alongside our multicultural young people, family and community to be able to deliver services and support. So for us at Headspace and for all our services, we're really promoting and wanting to strengthen that focus of critical reflection, having, I guess, a culture of ongoing learning and cultural humility in everything that we do. And that our services can integrate the cultural factors of individuals, so things like their beliefs, their value systems, customs, language, lifestyles, and the connection as well. And I think you'll hear a bit more about this when Headspace Dandenong speak about the experience, but certainly it really aligns with what the Embrace team have pulled together in this framework as well. So I'm probably speaking to people very well experienced in this space, but we always think about our team, especially at National, is why are we doing this? So why do we partner with organisations or orgs and young people to better our service? We know that for here in Australia, many multicultural young people between the ages of 12 to 25 continue to have barriers in accessing the health system that are actually caused by the system itself rather than the individual. So that means when they're reaching out to services, it can feel like they might not see themselves in the people that are providing the services. They might experience culturally unsafe practices, or that staff might actually have training or confidence in actually understanding the intersect of young people's backgrounds, including their cultural backgrounds and all other identities, when they are asking for help and for support as well. We know our systems here are complex and hard to navigate, and the referral rules can change within an hour. I know in my own practice, I've wanted to refer a young person to a service, and then I'm about to send the referral information, and then when I went to check up, it's completely changed or criteria has been added. So it can feel like many doors close on many of our young people, but in particular for those who are already experiencing additional barriers to access as well. It's really clear that structural solutions need to be embedded into the work that we do, and that it has to be a whole of organization, whole of service, whole of staff approach. It can't just sit on one person, but it has to be everyone being responsible to ensure that we are providing services that are culturally appropriate and recognises the strength of culture, particularly with the young people that we are now seeing through our doors. In terms of data, for those who needed data, want to fill their cup with data, for here at Headspace, we still see multicultural young people. As you can see there, that's our recent stats. And that we are, but we do recognise that there are many diverse communities that we also don't see, and we know we need to work hard in that space as well. So again, this is why it's so important for us to partner with organisations like Embrace to look at the structures and how we can continue to improve that, so that we also have an opportunity to connect in and lean into communities that we don't see as well. As you can imagine, for many diverse communities, and particularly what we're seeing with multicultural young people coming through our services, they're often experiencing lots of different things at once. I don't know if anyone remembers being young, and what life was like and what you had to navigate, and the confusion and the question about identity. But certainly I think young people now in this day and age are often experiencing that plus more. I think one of the big things we often see, more so probably in a youth space, is that generational shifts, those generational gaps in terms of culture, knowledge, connection. We're seeing lots of young people probably in that second to third generation, and they're still experiencing that sense of who am I in this space where there's so many influences around me, but how do I still feel connect to my culture and what's important to me as well. From a family lens, it's very similar. We often speak with family who are worried that their culture is being lost amongst the diversity of, which is great here in Australia, amongst the diversity. So it's also trying to provide a space for them to hopefully explore what that can look like as their young people grow up into adults and become part of sort of the wider community as well. In terms of how the gaps impact young people, there's a couple of quotes here. I won't go through all of them, but as you can see, probably relatable. As adults also feel like this as well, but certainly this is what we hear from a young person as well. I think what stands out for me here is that opportunity to connect with someone that just gets it, that they don't need to be explaining. Young people don't want to be explaining their culture or cultural influences to people. They just want to connect and be understood, which is a struggle in lots of spaces, but also something that our young people really want as well. Again, probably speaking to everyone here, that we're very probably well aware of the challenges faced by multicultural communities more broadly, and really highlighting that it's a systems issue, it's a structural issue rather than an individual as well, that we need to keep mindful of as well. So what's work is needed, and I think this is a really good connection point again to the more practical things that we can do as organizations and services, particularly in the youth space, where we do have a generation that is growing into a very different society from probably what we grew up in, and how we consider that. So we need to think about leadership and strategic planning, how we collect data that is culturally safe and appropriate, and asking about story rather than numbers, because I think that's sometimes where we get lost in terms of data. Culturally safe service design is key in terms of how we deliver and who we deliver to, and keeping in mind again the diverse communities our services are surrounded with, partnerships. We can't do it without each other. We're all working in similar spaces. Let's do it together. Let's learn from each other. Let's lean into that. And of course, culturally responsive workforce. It's great to have the structures in place, but as we know, if we have a workforce that hesitates or doesn't feel confident, particularly young people, they will not come back. And that will actually, the way that they interact with a service the first time is going to give them, I guess, a blueprint of what they think will happen the next time. So it's really important for us to really think about what does it look like from the first moment a young person or anyone accesses our services, right from when they pick up their phone, right through if they're filling out a form, and of course in person as well. So that's it from me. I've talked a little while there. Hopefully that was helpful to everyone in terms of setting the scene of Headspace National and why we've engaged with Embrace. As always, the Multicultural Practice Team, this is our email address. Please reach out if you've got any questions about the project, some of our key learnings from a youth service design perspective, but also if you're interested in any of the work we're doing, I'm more than happy to have a discussion. But that's it from me. Ruth, I'm going to hand it back to you.
Thanks, Christina. I think it was really helpful to get that broad overview of the work of Headspace and the context of which we're all working in. I'm really excited now to hand over to Deirdre Brown and Laura Boscalia from Headspace in Dandenong, and they're going to talk to us through how the framework was applied in their centre in Dandenong. So, Laura and Deirdre, over to you. Thanks.
Thanks, Ruth. Hi, everybody. And as Christina said, it's a real privilege to be here and to share the work that we have done at Headspace Dandenong and working in partnership with the Embrace team and looking at the framework. I am the centre manager for Headspace Dandenong. I use she, her pronouns, and I'm coming from the lands of the Burrumbang people of the Kulin Nation today. I'd also like to acknowledge our First Nations peoples and the traditional custodians of our lands, and just also acknowledge the wonderful cultures that make up our beautiful country, and acknowledge anyone on this call today that is a part of our First Nations peoples and people with lived and living experiences. I'm just listening to Ruth and to Christina. I sort of looked at what we're going to present today, and I actually felt really validated. And I'm hoping that the things that we will share will just highlight the journey that we have been on. And by no means has it been a simple and quick journey. And we'll go through that, Laura and I, together, and just highlight some of the things that have worked well. And of course, you know, we don't live in a perfect world, and there are times where things don't go right, and we acknowledge that. But today it's about sharing the things that we have implemented and that have gone well with us. Laura.
Thanks, Deirdre. Good afternoon, everyone. I'm also pleased to be here today and talk with you all about our experience with this framework, and it really has been a journey with this framework. So we hope to share some of our learnings, challenges, and positives as well. So the journey began a few years ago when Deirdre and I started in our roles together at Dandenong. And although we both worked in headspace centres, we were fairly new to the Dandenong community. And we realised that we had a lot of questions around how we were going to truly respond to this unique community. What we did know at the time, which Christina and Ruth have highlighted already, is that there are lower than expected numbers of young people from refugee and newly arrived backgrounds who seek mental health services, and overall that people from culturally diverse backgrounds will seek mental health services when they have higher intensity needs. So they're not seeking early intervention and care. So this really prompted us on this long journey that we've been on. Next slide, thank you.
Looking at our community profile was really important. And, Headspace Dandenong is located in the southeast metro part of Melbourne. It's defined by its extraordinary diversity and resilience. It has over more than 150 nationalities and one of the most culturally diverse places in all of Australia. The diversity is not just reflective of its statistics, and I guess we're looking at data and statistics in a very different way to really truly understand our community. And here we look at the everyday life of our communities, the families, the languages, the food, traditions, and all of those sort of things that shape the fabric of the community here in Dandenong. And if you've ever walked around Dandenong and really sort of looked at different places, its vibrancy, especially at nighttime, it comes alive, and you're spoilt for choice of wonderful food if food's your thing. Around 3/4 of our families in Dandenong have parents who were born overseas, and approximately 70% of residents speak a language other than English at home. The multilingual environment creates both richness and complexity in how services are delivered and how communities connect. Dandenong has also played a significant role in Victoria's humanitarian story, being home to around 1/4 of people seeking asylum in the state of Victoria. Alongside of this, we have about 130 young Aboriginal and Torres Strait Islander young people in the greater Dandenong region. And I guess one of the things that I really highlight from the community profile is that these layers of culture, history, and lived experience make Dandenong unique and vibrant, and the diversity shapes Dandenong as a dynamic, multilingual, and socially complex community. Thank you. Next slide. This tells a little bit of our story, and we came into the project with Embrace, but it wasn't the beginning of our story. Our story started back, as Laura said, when we first came to Dandenong and thought we didn't know what we didn't know, and we had to look at what we needed to do, and we were looking for guidance about how we were going to really deliver intentional services for the community. We knew that there were organisations already doing this meaningful work, and certainly in culturally responsive practice, and we were keen to learn from them. And so after a bit of exploration and Googling, we came across the Embrace framework, which really resonated with us. And we thought, well, it was a really strong and practical starting point for us. So we did establish a working group, and we used staff from across our service. And we were intentional about bringing people together in different roles. And we were fortunate to have a team that reflected a range of diversity and, from backgrounds and also perspective. This was really part of the strength in being able to shape our approach. Again, like many long-term pieces of work, our progress hasn't been linear. When there have been times when our priority has had different focuses, we haven't been able to, go back and really focus on this work. Other things have taken us away in different directions, hence why we sort of started in 2022 and we're talking to you in 2026. What we did know is that we were a little bit stuck. And when the opportunity came along to participate in this pilot project with Headspace National and with Embrace, we saw this as a real opportunity to refresh, regroup and refresh the work that we had done and help us with reconnecting with our purpose and giving us energy and looking on how we would have greater clarity to move forward.
So you'll see here over the next couple of slides is our self-assessment results. So this is using the Embrace Framework self-assessment tool that is readily available on their website. And we completed this tool together with our working group early on in our journey with this framework. So there is a lot on this slide, and just to highlight that there are 4 service modules within the Embrace framework, and then a number of key principles that fall within each of those modules. And then you'll see there in the last 2 columns, that's our self-rating which is when we had just started embarking on this work. And then about 18 months later, we completed the self-assessment tool again. And then there's 4 different ratings, rating from pre-entry, starting out, developing, and then on to advanced. And so our intention with sharing these results with you today is not to show our progress, I guess, or success, or there has been some, but just to highlight that doing this tool, doing this self-assessment was useful within itself. So we found that when we were doing this as a group, there were some discrepancies across the group around our ratings, and that actually helped to bring up really rich discussion within the team, and then it helped us to generate lots of different ideas around what needed to be done. And we also noticed that we really needed to do this assessment authentically and ensure that we're moving beyond just the principle and into actual practice, and not just ticking a box to say that it was completed. And this is the second half of our results. We also use this tool over this journey to look at what areas were needed within our centre at the time, because this can really change, and we can use the tool to refocus our attention on different areas. And it's also allowed us to track our progress. Sometimes it has felt like we were making very slow progress or no progress at all, but then coming back to this tool helped us to see that we were making progress, and that, I think, keeps the journey moving along. So over the next couple of slides, we'll have a look at some of the actions that we've completed from our action plan.
Great, thank you, Laura. And again, part of the project that Ruth referenced was that the centres were to sort of develop their action plans. And, we were lucky that we had started the action plan, although it become a bit stagnant. As we said, we needed to renew and refresh ourselves. But it did become our guide, and it helped us to really clarify what we needed to focus on and how we were going to approach the work in a practical way. And, we talk about, great frameworks and services, but we were really on the ground at grassroots level trying to make this work and to see what we could do to really make a change. First of all, I guess focusing on ourselves as a service and our workforce, and then obviously we've got a lot to go when it comes to working with community. We formalised our group's name, and we now called the Cultural Safety and Inclusion Working Group, and that gave us some really clear identity and purpose across the service. So it really communicated and resonated with the rest of the team that our focus was really about improving that cultural safety and being inclusive of all. We do review data monthly, and we look at trends, and we try to get a better understanding of community needs. We're trying to look at different ways of doing that. As you know, Christina referenced, it's not just all about numbers and percentages. What other ways can we look at to be intentional rather than making assumptions about our community? We've prioritised communication, keeping the wider team updated on our progress, and we also share that with our lead agency, which we sit under, and that's each community health services. So we're trying to broaden out our work and really sort of try and find resources to support us, but influence other aspects of our organisation in the success that we're having. Another key learning for us was recognising the strength of our workforce. We've just recently introduced our own multicultural practice team, and we've got some roles that are made up of people from different cultural backgrounds, and they bring a lived experience and cultural knowledge, which provide that stronger connection with community. I think our underpinning vision with all of this is to truly make a safe and culturally safe and inclusive place, and truly welcoming diversity. And diversity is very broad, and I guess we work in a headspace model of no wrong door policy, and that our services are open to young people, and so that a young person feel that they can access support in a way that works for them. Thank you. Next slide. Laura.
Thanks, Deirdre. So over this slide, you'll see some of the actions that we completed early on in this service journey, and we really looked at the front end of the service and thinking about how to make it more culturally safe and responsive from the point of the front door. So we looked at our environment in the waiting room, and you can see some photos there, and having access to different translated materials in the waiting room, which some of those materials have been created by Headspace National, but we've also created some of our own local translated materials, and we've now got a resource bank of materials that staff can access as needed that's kept online. Really made sure that staff were able to work effectively with interpreters and complete training on that regularly. And we've seen an increase in interpreter use since we've begun this project. With the use of interpreters, we've also allowed for longer appointment times. So individual sessions are 90 minutes and family sessions can be up to 2 hours. And that's required for the longer time it takes to interpret. We also looked at how to diversify the entry points into the service and ensure that there was some soft engagement pathways in, and we removed the requirement for unnecessary assessment procedures at the front end, which we know can be culturally insensitive. Thanks. Next slide.
We are going a bit of ping pong, Laura and I, but I guess, you know, this is work that we've really shared a journey on. So we've sort of, you know, sharing how we deliver this information to you. But our partnerships are really crucial, and you know, I'm sure that you'll all agree our services can't be all things to all people. We have to think about how we work across diverse communities, and what is important for us to focus on when we are collaborating, and collaborate with purpose. And that's been our real focus, and how do we work with others to improve access, reduce stigma, and support better outcomes for young people and families. Building these relationships has taken time. This is not a quick fix. It takes time and it's very slow work. And the thing that certainly we have learnt from this is to be patient, and having that patience and thinking about being intentional about whom we're reaching out to and partnering or having collaboration with has been really important in the success of some of the things that we've achieved so far. It's required trust, consistency, and a genuine understanding of what each organisation brings to the table, because each organisation will have their own area of expertise, their own priority and their own values on how they deliver their service. At Headspace Dandenong, we have a consortium who share a commitment to ensuring and supporting young people and families around the community listen to and also reduce those barriers to the services. It's given us a strong foundation to work together in a meaningful way, and these are some of the things that we have done. We're often asked to present at different events and forums to promote mental health in ways that feel accessible and are culturally relevant. We've partnered with Foundation House and they've delivered training for our staff, but we also work quite closely with them with young people who are sitting on their wait lists for very specific trauma-related supports, and we hold that young person and sort of support them in the ways that we can until something becomes available at another service for them. We contribute to the broader systems and we sit on steering committees, and one example of that is we're on a steering committee at the moment for intergenerational trauma, and thinking about that disconnect of families and culture, and then young people being brought up in Australia and having a different way of thinking, and sometimes the anxiety and conflict that causes between both family and young people. We have worked with the CNY Lamania Pacifica group, young people, and who wanted to create some posters that were culturally resonating with their young people to promote health and well-being. We have a caregiver support group information sessions that is a collaboration with YSAS, Family Life and ourselves at Headspace Dandenong. And this is now happening up in a space in the Dandenong hub, which the young people have called Third Place. And they've called it Third Place because it resonated with them to think about, well, first place is family, second place is community, and then third place is another safe space. And they can access this place, for food, for supports, for a whole range of activities that are provided. And the long-term projection of this is that it will be all community running different opportunities and programs for young people. We also offer youth, a multicultural practice team also offers youth mental health first aid training and tuning into teens. And whilst we don't offer that in different language at this stage, it's something that we know that if we can then find the support and the resources to do that, that would really change the way that we're able to sort of provide a different type of support for community. I guess the key learning from this is that effective collaboration is built on relationships, and I guess that's not a new statement to make. We all know that, having that is essential in the work that we do, and just showing up and being consistent in the community can make all the difference. Next slide, please. We talked about building a culturally responsive workforce, and if we go back to our self-assessment, we got to a point where we think, yeah, well, this is something that we're actually doing well and that we've become quite proud of. We did, again, seek support and advice from organisations that already existed and were doing this really well. And so we used their targeted strategies to look at recruitment. We then, as I said, have got our multicultural team that very much is specific in working into outreach and working into communities. And some of that work now is working with the Noble Park English Language School and providing a range of services out in the community. It was also too important to support the identified and lived experience of our workforce. Many of our staff have come from a migrant and refugee background and have gone through a journey either as a young person or as a family member coming into Australia. It meant that we as a leadership team needed to be culturally responsive. We had to look at how we provide supervision in a culturally responsive way and look at what other supports are out there aside from ourselves to provide cultural supervision. And that's a piece of ongoing work that we're looking at. When we do recruit, we use our young people. We have a youth reference group, again, that are made up of a diverse group of young people from different backgrounds who then sit on those recruitment panels. We have questions that we try to get a sense of someone's experience working in a culturally diverse community, or at least having an understanding of what's required to be able to support a multicultural community. We have also made it mandatory that all new staff that come into the service train in cultural responsiveness, awareness and responsiveness workshops, and also interpreter training. And as Laura mentioned, we do a lot of work with interpreters, and which is increasingly happening because staff are becoming more confident. When you support staff and give them the right resources, then they become confident to sit in that space. Importantly, we've worked to create an environment that where diversity is visible and valued. We celebrate cultural days, we celebrate staff. We ensure that leadership continues to be very visible and champion the work that we're doing. Thanks, Laura.
Thanks, Deirdre. I know we're running a little short on time, so I'll move quickly. Deirdre mentioned that we have a number of new roles. So they're listed on the screen there, and we're really fortunate to have these new positions that are identified positions within our workforce. And then you also see a diagram next to it, which is the services model that we've put in place around this work. So in the inner circle there, you'll see the service components that are being delivered by the team, and then on the outer circle, the enabling components that support that work to be delivered. So this is a model we're hoping to continue to develop and grow over time. And onto our last slide. Thank you. We'll finish with some just quick final thoughts and reflections. This work, has been challenging at times, and making sure that we can balance our workload and other service demands whilst maintaining a commitment to this framework has brought up its challenges. So we've had to be patient and flexible around that, and understanding that we've all had to step away for different reasons at different times to do other work. We also know that this work takes time, and it really is a gradual process requiring that patience and consistency.
Thanks, Laura. I get to have the last word, and I guess it's just I'd like to finish with that. It's work we commit to every day in how we support our young people and communities. Without the commitment and the leadership and bringing your team on the journey, it makes it a lot harder. It's great to have the supports, the collaboration, and people around you to help you support the work. Our next step is then how do we listen to community to really continue to work in the real, true process of co-design. So thank you.
Thank you, Laura and Deirdre. It's been an amazing presentation of all the work that you've done. And I'd just like to highlight that both Laura and Deirdre go into the framework and the elements that are in the framework in a lot of detail, specifying the modules and some of the principles and the strategies in the modules in the framework. And if you'd like to know more information about that, they are all in the framework. But I'd also really like to acknowledge the fabulous work that you have done at Dandenong in using the framework and applying it to your community, and it really shows in the presentation today. So we do have time for some questions. I have noticed there's around 4 or 5 questions in the chat. If you do want to ask a question, we do have a few minutes for those now. As I said, we will be pulling all of this work together and developing a national approach for implementing the framework across headspace centres. And one of the first questions that we do have around that is for Christina. And the question is, will all headspace centres be expected to complete the Embrace framework once the headspace specific version is released? If so, what is the timeline for this body of work?
Yeah, good question. The short answer at the moment is no. So what we're seeing is that, as I've mentioned, we have so many centres across the country, and that each centre needs to meet the local needs of their community as well. So what we're hoping is that for centres who identify a large multicultural community, or they're seeing underrepresentation of diverse communities in their centre, that they can use the framework to help guide them, similar to how Deidre and Laura demonstrated, just to see where they're at, to be honest. And that can help sort of take the next steps forward for that. So at the moment, there's no compulsory all centres have to do this, because I can imagine, I've worked at a centre before as well, like there's lots of competing priorities and demands, but we just want to make sure that there's something a centre can lean into if they're interested and want to build the capacity around this type of work. Yeah.
Thanks, Christina. And the next question I'll ask Laura or Deirdre to answer. And the question is, one of the challenges is stigma and shame, and I'm wondering how and what we can do to make an impact in this space so people feel comfortable to engage with their services. And have you done any work in this space?
I think we probably both can add to this, Laura. I wish I had the answer. I don't. And, again, we talked about slow work and looking at what resources do we have, and we have a great community engagement team that is part of the Headspace model that does work on those relationships, that does go out to communities, sits at events, and just has a presence so that when people want to approach them, they can then start having the conversation. But it is a long conversation, and we continually work on ways in which we can try and address the stigma and the barriers to young people accessing mental health. Laura, oh, sorry.
That's fine. Laura, did you want to add anything?
I'll probably just add that when we think about some of the practical things we can do around ensuring, privacy and confidentiality, and thinking about where we deliver mental health services to encourage that. There's some of the small things that we can do to help address some of the fear around using mental health services, thinking about the type of language we use and really trying to reduce the use of jargon terms and understand mental health from the individual's experience. So there's some other things that we can do on the ground.
Thank you. We do have a number of other questions we won't get to, but we will find a way to answer these questions. Some of them include working with interpreters around racism and discrimination, about working with people who don't want support from someone from their same culture, and more questions around stigma and translating services. So we'll attempt to answer these questions in another format. But I would like to say that the Embrace team is available if you'd like more information about the framework. If you would like to talk to us about how your centre could use the framework, please feel free to email us or to give us a call. Similarly, I know Christina's team is very happy for you to contact them. The details are up on the screen. So please feel free to reach out to either the Embrace team or the Multicultural Practice Team. Also, please use the QR code there to reach the Embrace framework and have a look at all the resources that we have on the website for you. There's lots of things that will help in this work. We'd like to thank you for joining us for the webinar today. And particularly I'd like to thank Christina, Laura and Deidre for their wonderful presentations. And please take the time, if you can, for filling in the survey that's popped up on the screen now, which you can access through the QR code. We really hope that you have enjoyed hearing from our speakers and have taken away some insights and learnings that you can apply in your work. Thank you for your commitment to working with people from cultural diversity and for improving services in this area. I'd really like to thank you for your time this afternoon, and please, as I said, feel free to reach out to any of us if you'd like more information. Thanks for your time and have a great afternoon. Goodbye.